That started. All right. Well, welcome everybody to Moving Maine's mobility learning community. We are excited to have Alice Gormley with us today presenting about work that's going on through MaineHealth to help folks find rides to medical care. And we look forward to a really robust conversation about what's going on there and how people can help get more transportation resources listed in the FindHelp.org platform, and just talk about some of the barriers and opportunities are there. So I always like to start off these meetings by just saying a little bit about what Moving Maine is, and been a little discombobulated this morning with the thunderstorm. I know it's sort of making its way across Maine. So fingers crossed that our internet will hold, but Moving Maine, we are a statewide coalition focused on improving mobility and access for everybody with a strong focus on the folks who have the most barriers. And these learning community sessions are our way of bringing people together to build relationships so we can find information and connections to make solutions happen. So we are going to spend the first part of our time together hearing from Alice. She has some slides to share and some information, and then we really want to open it up for a conversation. We'd like to offer up this space to our presenters to get information from the group as much as they are sharing the information. So as we go along, if you think you have suggestions, ways to help, we want you to make note of those and be ready to share. And then towards the end, we'll have time if folks have general updates that they want to share information on. I'll share a couple updates on what's going on with Moving Maine. And that'll be it for our session today. We are recording and we will be sharing it on our YouTube channel after today. So with that, I'm going to hand it over to Alice to kick off our presentation.
Thank you. Oh, now it says host disabled screen sharing. We were so close.
Yeah, we thought we had it all figured out. Okay, hold on. I'll make it so you can. I'm going to make you the co-host, and then you should be all set. Never a day where Zoom does exactly what I expect it to do. I don't know. There we go. Thank you.
There we go. All right. Thank you. So my name is Alice Gormley, and I work with the Population Health Management Department at MaineHealth. I know there's a lot of other MaineHealth members on this call as well, but I'll talk about a program that we've been piloting out of Population Health, and then also go into a little bit about FindHelp.
Sorry about that. You could write your name and date of birth here for me.
So just some background about MaineHealth. MaineHealth is a not-for-profit health system comprised of 9 local health systems across the state. And within the system, there is a complete range of healthcare services, from primary care, from pediatrics up to geriatrics, hospitals, diagnostics, behavioral health, complete range of care. And then the system has some strategic initiatives around healthcare access, and then a strategic initiative specifically around transportation as a supportive access. And then also part of that strategy as well is offering access to translation services and interpretation services. So assuring that access is offered to all patients. So I work in the Population Health Management Department, and just some background about what Population Health is a model of care that addresses the needs of a population. In this example, the population is MaineHealth patients, and subsequently people living in Maine and New Hampshire. And kind of the model of care within Population Health is interdisciplinary care with a big eye turned towards mitigating barriers in social determinants of health, as well as care coordination. And oops. So social determinants of health are conditions in a person's environment which impact their health status. So think kind of anything beyond the physical body that impacts your health status. And those are things such as financial resource strain, food insecurity, housing insecurity, transportation being the big one, of one we see often. And why a health system would be interested in addressing social determinants of health are because they are so impactful. Kind of the example is if a person is seen by a medical provider and they have high blood pressure and their medical provider would like this individual to work on lowering their blood pressure as their health outcome. However, that person is struggling with housing and struggling with food insecurity. Their first priority is probably not going to be addressing their high blood pressure. So by addressing social determinants of health, it's able to impact health outcomes. So the pilot program that my department, Population Health, has been working on, a big caveat is there are many other transportation initiatives across MaineHealth, so this is not the only one. So there are, a multitude of other types of transportation being completed within the system. My department also works in the ambulatory or outpatient setting. So the inpatient or initiatives involved with the hospitals may look different. But so within this pilot program, it's focused on a single source, or kind of centralizing the management of resources for practices to use for patients. A current state assessment really showed that practices all had a lot of different access to resources. They had different funding, they had different contingency funding. Some practices were using grants, some were not. So the resources were all different, and thus the resources for the patients were all different, and then their access was all different. And another goal with centralizing is then, with a centralization of the resources, we're also able to more accurately understand the need. So we're able to see kind of the more accurate numbers of how many patients or how many people are encountering transportation barriers. So this program has been piloted at a subset of ambulatory or outpatient practices in the greater Portland area. So they're the Maine medical partners practices in both primary care and specialty care. And what the program has entailed is sort of a toolkit of resources. So within the toolkit, we developed eligibility guidelines for practice staff to follow. We also went to all the practices and trained staff. Another thing we found in the assessment was that these transportation barriers are most often identified during the time of scheduling. So that's when a patient's trying to be scheduled for an appointment, and that's when scheduling staff or front desk staff are figuring out that they don't have a ride. Kind of another way is through, sometimes patients may get a ride to an appointment and then their ride falls through, so then they're sitting in the practice and the staff has no way to get them home. So the eligibility guidelines are a way for staff to assess kind of what the barrier is and what resource would be most appropriate for that patient. So by training staff at the practice level, that just allowed kind of clearer communication, less trying to call across departments to try to figure out a transportation resource. So just centralize everything, makes everything a little bit more streamlined. So within the eligibility guidelines, it walks through different options that are available and which options may be appropriate for that patient. So a big one is training on accessing community-based transportation resources. I've sort of given some shout outs to some in the bottom. But we've used a lot of bus passes with both Greater Portland Metro, B-Sub Transit, and then also the South Portland Bus. So there's a lot of our practices are on bus lines. We also were able to work with the bus lines to get some extra stops added. So that was incredibly helpful for our practices that were sort of near a bus stop or not necessarily directly on a bus line. So that was incredibly helpful. The Bus Ambassadors program from GP Cog has been also incredibly helpful for those patients that can access existing infrastructure. And then for some other patients who maybe are not on a bus line, or the practice is not on a bus line, or public transportation wouldn't be appropriate for them, we also have some taxi vouchers and then UberHealth available as well. So we've been able to partner with UberHealth to help coordinate rides that way. So this program's been running for almost a year. We're definitely kind of in the learning phases of what it will look like for a following year, and assessing sort of what the future will look like for the program, and learning from just feedback from practices. But overall, it has been very successful. The practices are very happy to have the resources. As I mentioned, our community partners have been so helpful in helping coordinate all this transportation. So some outcomes that we have from looking back at the past year with how things have been going is there's just been a big increase in access to healthcare services. So mostly we found that these appointments with patients, probably if transportation resources hadn't been provided, that they just wouldn't have been happening. So kind of looking at ongoing care and increasing health outcomes has just been able to increase access to these healthcare services. We also have done some audits and chart review, and we have all seen a correlation between providing at the patient level, providing these resources, and decreasing rates of no-show, as well as decreasing rates of avoidable emergency room visits. So for a chronic condition or some medical ailment that's happening to a patient, if it's not managed sort of at the primary care level, it may get out of hand and a patient may have to go to the emergency room. Whereas if they had been able to access their primary care or specialty care appointments, they would have been able to kind of manage those conditions and not wind up in the emergency room. And then just improve patient experience. So those times when a patient is unfortunately kind of left behind in a practice, they've been able to get home, they've been able to access care through that. And then some challenges is our kind of the greater Portland area has a multitude of resources. We have also a very rural state. So just resource access in more rural communities has been a challenge. We do work with Uber. However, Uber's not very reliable in more rural areas. There's just not drivers available. And then if we use a taxi, to get farther outside of urban areas is very costly. And then car seats, that's been a big issue. So for pediatric practices, an Uber or a taxi, they will not, if the family or child does not have a car seat and they're of car seat needing age, they can't ride in the car. So then the only option is the local bus. And then oftentimes a patient may not live on the local bus. And then just securing funding and sort of like what funding will look like in the future and whether or not grants will be pursued. Grants are fabulous, but they oftentimes have they have a limit to them. So kind of finding more sustainable funding options. And then opportunities are just awareness of local programs that already exist. I feel like every day I learn of a new program, and then also every day I get to teach somebody else about an existing program. And that's where a tool like FindHelp, I'll go into FindHelp a little bit next, but that's where a tool like FindHelp is so useful when users are engaging with the platform. It's just a way for more people to be able to coordinate care and find out about different programs. Utilizing existing infrastructure for long-term solutions. So that's kind of the workaround, just sort of expanding on what already exists, like providing a one-off taxi ride. It's great because somebody gets their medical care. However, they're not going to be able to, if they have a kind of existing transportation barrier, that one-time taxi ride is not going to alleviate that barrier for the rest of their time. So longer term solutions are just kind of, more investment in local transit options, ways that this person can alleviate other social determinants of health. And then we do have some goals to scale this program model across the state, kind of in subsequent years. But does anybody have, at this point, before I move on to FindHelp, I'll just pause a bit and I can answer any questions that may have arisen about this program. I'm just going to check the chat. Oh, okay. Any questions at this time?
Alice, this is Zoe. I just have a question about your data on reducing the missed appointments, and just, if you could talk a little bit about how you're tracking that. I feel like super exciting to hear that you are tracking it and it's moving in the right direction, and that's something that would be great to be able to do more globally across the state, just to have that data.
Yeah, so that particular audit was, we took a random sampling of patients who had received transportation resources. And for this particular chart audit, we looked at the patients who'd received taxi or Uber rides, and we looked at a period of time before they had received the ride and a period of time after, and then looked at their individual rate of no-show. So there was some impact on that. It wasn't incredibly significant, but there definitely was some impact. It also was it was probably, I think, about 70 people. So our hopes kind of for the next fiscal year is to expand upon that collection of data, for both a larger amount of time and then for a larger group of patients. And then we did a similar modeling for that same time period, both before and after, for emergency room visits, and looked at their utilization for the emergency room.
Great. And do you see those questions in the chat?
Oh, no, I don't. Let me see.
So we have somebody asked, does MaineHealth partner with Uber to start Uber for healthcare?
We partnered, so our partnership with UberHealth was actually through FindHelp. So UberHealth is a subset of Uber, kind of Uber the company. And I think Uber is getting into more healthcare initiatives. I know they're recently starting another initiative around prescription delivery. I think they're piloting a program where there'll be an option when coordinating an UberHealth ride to have the car stop at a pharmacy, like if a patient gets discharged from a hospital and needs to stop at a pharmacy on the way home, as well as grocery and food delivery. So as a company, they seem to be getting more into the health space. And there are several offices using Uber, several departments across MaineHealth that are also using Uber. So it's been wonderful. Definitely the barrier there is just all Uber drivers are independent contractors, so the reliability by region tends to vary. which has been a challenge sometimes. And that's with our designing of the program kind of as a sort of package of different types of resources to use. That's been really helpful. So then if a patient has this ride set up with Uber and that falls through, the coordinating staff has other options, and then they could get a taxi or use a bus pass. So they have multiple ways or multiple avenues to help that patient. And then, yeah, as Ellen said in the chat, from Uber, they have kind of more data. They've done some bigger studies at other health systems. So they have shown a big decrease in no-show rates at a lot of other health systems. And that's the work, kind of our next phase.
And then Alice, there's also Joe Cooper had a question on missed appointments. Do you have a formula on what the cost is of a missed appointment?
I think, and I think it's around, it gets hard because there's like a facility fee, and when you get into the weeds of kind of an exact cost, there's a facility fee, and then the time and kind of staff time is a harder metric to quantify. But the number I have heard is around $180. But I don't know if that, I wouldn't quote me on that, but I think that's kind of ballpark around how much a missed appointment would cost. All right, any other questions?
Alice, this is Sarah Cushman. I was a little late. I totally apologize. So you might have spoken to this already, but is there also sort of a percentage where you just, like, I think I came in, you were speaking to this of like a percentage of folks who just, is there a way to guesstimate on the percentage of folks who just don't make it for the reasons you're talking about, for transportation barriers that you're talking about, and maybe not knowing that they could reach out for rides or for help? Just curious.
Yeah, no, that's a great question. I think there definitely is a percentage. I wouldn't feel comfortable making a guess onto an accurate guess. What's involved in a lot of this work as well is documentation of social determinants of health. So kind of previously within a health system, in a patient's chart, there's going to be a multitude of data on that person that's all related to their health outcomes. And what's not being captured are those things such as food insecurity, the fact that they don't have a transportation to their appointments, and that's why they're no showing. So a lot of this work as well involves improving upon documentation of social determinants of health, with a goal being that would be an exact figure that you'd be able to get. So you'd be able to say, okay, how many of these people at this one practice have a transportation barrier, and then you can compare to their no-show rate there, or if that data was being captured in some way, and it is being captured to a certain extent. I think there's some opportunity there, but that is involved in the work that we are doing. All right, any other questions at this about so kind of in the vein of awareness of existing programs, MaineHealth has a partnership with, or a subscription with, a company called FindHelp. It was previously called Aunt Bertha, so if anyone knows it as the name Aunt Bertha, about a year or two ago they changed the name. So it is an online directory of free or reduced cost resources that anyone can access. So patients have access to this. Any of you have access to this. MaineHealth staff have access. And it really just serves as a database. So resources can be listed on here. They also can elect to be more engaged and kind of manage their own program listing. But I use Bus Ambassadors as an example here. So if I were searching for a transportation, as you can see, the transportation is like the first tag right there. But if I searched, I came up with this program. They'll have information about the program. If I was coordinating care for somebody else and I wanted to refer them to this program, so there's information here about what the program is. You can directly refer them right to that program. You also can save, you can share. There's some functionality to print materials and or translate materials, so you can get that translated. And it just saves some steps, if you're coordinating care or if you're searching for care for yourself. So it's just a single source of resources. You can sign up and create an account. So I have in the next slide, and if Zoe, you could send them out, I have a link to the MaineHealth FindHelp. So you can all, if you would like, you can make an account. If you work at an organization that you find would be beneficial for people to connect with, if you kind of are looking to get the word out about an organization that either you work at or you just know about. So a resource can just be listed on there. It's sort of like a very specialized Google. So if you just have any sorts of resources that you're searching for, you can have them listed. If you work at an organization, you can also sign up and then you can manage that listing yourself. Right now, well, what it will do, the way it works is it'll just pull information off your website. But by engaging and signing up with it, you can manage your listing yourself, as well as managing referrals. If you wanted to use FindHelp as a source to manage your referrals, you also have access to analytics. If in the next slide as well, I have also linked informational video, as well as my contact. So if anyone's interested in more information about FindHelp specifically, it's a really great tool that, a lot of MaineHealth coordinators of care use. And then patients also have it linked in their kind of portal where they access information. I'm just going to read this question in the chat. So there's a question about if a patient relies on volunteer transportation. This is wonderful feedback. And this again is kind of like the next step goals of this pilot program is really to improve upon the documentation, because the question in the chat is wondering about if a ride is 5 minutes late and the appointment's canceled. That unfortunately is a large problem. And then Uber is also, they'll only wait 5 minutes, and then if not, they'll go on to their next ride. Taxis are kind of similar. So that, I mean, that's great feedback. I'll take that into kind of our work within transportation. If a goal of mine would be to try to figure out a better way within a patient's chart for across the care team to see that the patient has a transportation barrier. So then things such as if they're slightly late, and a lot of that, I mean, has to do with kind of bigger ways things are organized, and with scheduling. But that can be, it's a great point and wonderful feedback. And unfortunately something that does happen, just due to kind of lack of awareness. And that is kind of why we trained at the practice level, because they are interacting with the patients, they're performing their documentation. Like if this was all being handled by like one department of transportation, they're not right there with the same access to the patient. So that was one of our goals in the way this was organized, was to kind of keep it as centralized and localized as possible. All right, any other questions?
This is really great, Alice, and I love like just some of what's already popped up in the chat. I think one thing that Alice and I had talked about was how to, how to ensure that the resources are more robust. And Ellen, right on cue, has raised her hand to talk about that. So perfect, go for it.
I guess I wasn't sure that's what I was raising my hand for, but I'll talk about that. I think what's come up recently, this is, this package that Alice, sort of put together of all the transportation options is really kind of what is needed, because there's no one perfect, solution. But recently questions have come up around the transportation brokers and the Maine care, move care services, particularly in mid-coast area. And some of that's getting, new Mainers who are relocated up in Brunswick and Freeport to care, potentially in Portland. So how do those services connect, or how can we better connect with those services? Many of them are listed, and many of them are sort of organized, sort of affiliated with this group. So was really just a request to see if we could support those services, learning more about FindHelp, claiming, which Alice mentioned as a way to manage the listings, maybe take the referrals or upload eligibility criteria right on the site. So sort of avoiding some of the next steps with people calling a phone number or going to a website. They can do it right here on the platform. So that, that is a big need to make that, to help make that, just work for all of our patients and community. I don't know if anybody can speak to that.
And I think part of what would be interesting to know is, what ideas people have for that, how to make that happen, so I think it's sort of like, if there are resources in your community, but they're not there, they're not claimed, are you in a position to reach out and say, hey, it's be really valuable if you claimed your resource, and here's why. And maybe if they heard that from folks like the stakeholders on this group, they'd be more likely to do that.
Yeah, I think that's definitely one way. And I also know that, there's often lists, PDFs and resource lists that go out, and people keep updating that. So the beauty here is that this information can be constantly updated. And, if a service is closed, it can be, put on FindHelp, temporarily closed, or things of that nature. So it's more in real time. It doesn't get outdated as quickly. And we do have a lot of these services are on there. I mean, I did a search for Mid-Coast, and the services are on there. They're easy to find. But again, maybe the services don't know that they're on there, and that, and that's the other thing. Just so today was good for awareness, and to encourage people who work with, serve transportation needs to look and see if their services are listed, and if they're listed accurately. I mean, we also have New Hampshire on the call, and we do serve MaineHealth does serve New Hampshire, so that's always something to keep in mind. Hello, New Hampshire.
So I see Terry had a question in the chat of, do you try to use public transportation when possible, or do you go right to UberHealth? Alice, do you want to speak about that?
Yes. Yeah, so within the eligibility, you the idea is to go through a decision tree to first rely on public transportation if it's available, or first rely on public transportation, then maybe a broker service, a community resource, and then kind of Uber and taxi are more of a last resort when that's the last option. And sometimes that is the only resource, so sometimes you quickly go through and realize that all the previous options aren't appropriate for your patient. But so it's first transportation, and that's what we provide the practices with bus passes, which are good for Greater Portland Metro, BSUB, and the South Portland bus. And then kind of down from there.
Well, thank you very much. It's really interesting to learn about this and see some of the data and to know that there's potential to expand. At this point, I wanted to just sorry, I have a cat who's decided to make noise behind me at this time. But I wanted to open it up to if folks want to share information about something that they're working on, or make a comment on transportation in Maine that's not related to what Alice shared. You can do that if you, and then we'll just continue if folks have additional questions or comments about findhelp.org or about MaineHealth's pilot, you can include those as well. Harry, I see you have your hand up, and then Elizabeth Gatine.
Hi, everyone. Terry Palmer, Statewide Mobility Manager for the state of New Hampshire. So I have a question about the FindHelp website. I'm not sure if some of you are familiar with the Unite Us. How is FindHelp? Is it like the Unite Us network? Unite Us is basically referral based. When you mentioned about the FindHelp site, I've been kind of messing around with it a little bit, but so is that something that is referral based as well? So I would, if I was a medical health provider, I could refer someone to a transportation provider. Could you explain a little bit more about FindHelp, please? Thank you.
Yes. So the kind of the program's level of engagement with FindHelp varies. So if you were a provider searching for a resource, it might come up with 3 resources, and then it's sort of up to the resource what their preferred mode of engagement is. So within the platform, it'll say there's a line that says best way to connect, and it might say go to their website, or it might have their phone number. Some more engaged levels are, it might have like their referral website linked within FindHelp, or you might be able to log a referral directly. So there's kind of several different ways to do that. So you'll see, depending on the resource, it will be kind of varied on how you engage with that resource. But FindHelp and through the platform, it will tell you. And Ellen, I don't know if you have anything to add.
Well, I was just going to say Unite Us and FindHelp are very similar.
Okay.
You do the same thing. We've engaged with FindHelp at MaineHealth, and now Northern Light Health is using MaineHealth. 211 Maine will be starting to use FindHelp. Intermed is using FindHelp. So it just made sense not to create another platform. I mean, the platforms, as Alice was trying to say, they can communicate with each other, but it made sense not to create another one if we didn't have to, given that all these health systems were starting to work with FindHelp, because we can each integrate with our own Epic system, but all the resources are the same across the state. So it doesn't matter if you're Northern Light or MaineHealth, the resources are the same, but there is a staff Epic or electronic medical record side to the platform as well. So that would be unique to the health system. So Terry, that's a great question. Terry, it's great to see you, because I was thinking Terry was a guy. So anyway, it's great to see Terry as a picture. Memorial, which is part of MaineHealth, we're really excited to have them engage more with FindHelp. It's been harder because most of us are looking for, Maine resources, but working with Memorial Suruka to add as many of the New Hampshire resources. So, reaching out to her, supporting us, and that would be fantastic.
Great. And then I see, Joe, you had your hand up, and I didn't know, I wanted to make sure we go to Elizabeth, but were you going to comment on this topic, or?
No, it may be Elizabeth's going to bring up the same thing, just in a
Okay.
different, okay.
Okay, so we'll go to Elizabeth and then we'll come back to you.
Okay.
No, I think just to say, Terry basically asked my question. I guess, I was curious about FindHelp and why FindHelp over other platforms and, over 211, but it sounds like, Ellen, you're saying that even 211 is looking at this. It's just so many different tools out there that is part, to me, of the fragmentation of how people get information and receive information. But does it sound like FindHelp is sort of bubbling to the surface across
It
the health
does.
systems?
It does. And we have a Maine collaborative of all the partners who are using FindHelp now. We have a New England collaborative, people in, New England states who are using FindHelp. So we're really trying to, support each other, and everyone's at a slightly different stage. For 211, it wasn't quite so easy because they had to reconfigure a lot of the system behind the scenes. They didn't use the same API. So they've been working on that so that the two systems can communicate. And then when that happens, which is kind of happening now, 211 will be in a different position to sort of launch their FindHelp. So that's still to be determined. And it's it isn't the only service for sure, but it is, it does help with the decrease to fragmentation, given that many of us are using this.
Thank you. And Joe, did you want to add anything, or did
Well,
get it?
the direct linking is, I think, a key component in whatever system that you're using. I actually did set up on a mini basis, one county only, with 211, so that if they had queries, they could be directly put into our system, weirdly enough, but nobody understood how key that could be for the patient to be able to be directly connected with the service and for the service. I mean, there's just that missing link when people can't access the transportation service. We were a community-based program, as in your lingo. So, but I think that if you approach it through the patient and you're trying to solve that particular problem, another resource that we're working on, making volunteer transportation maybe more volunteers more accessible through having gone through a program or been vetted through a community services through Go Maine. That Go Maine would be a way that through an interactive map, and you've got particular residents trying to connect with a particular destination, and it's not always tidy. And when you mentioned the going down that decision tree, but when you're in that place where there aren't those resources, where this might be a way to access a solution to a particular problem. It's a little complicated, but
yeah.
Yeah, and sorry, go ahead.
I was just going to say, volunteer transportation is definitely something we would love to work with more. Another barrier we have is when a patient needs like a very minimal amount of transfer assistance, like basically they maybe need someone to help them get in and out of a car.
Right.
And Uber drivers are not supposed to do that. A taxi driver is not supposed to do that, but they don't need a full medical transport. So there's this kind of middle area where I'm sure a volunteer driver would be happy to help someone in and out of a car. And I understand the reasoning why a driver can't do that, but that's where, something like a volunteer driving program would be wonderful for those situations. So
I think there are some listed on FindHelp, but that's where we would need folks' help here. Some through churches or certainly the volunteer transportation network, but there's costs associated with that. So again, this is free and reduced cost. So you want to keep that in mind. But I think if there are very local, because you look up a zip code, this is very local, and it says right on the card, this only serves, people in Gloucester, Maine, so you kind of get that specifics, and you wouldn't get inundated with calls. But those local transportation, the volunteers, they fill in the gaps, in rural areas. So if they're comfortable being listed on the site and we don't know about them, you can just go on there and suggest the program. And it takes a couple days just for it to sort of kick in. Like an individual can't go on and just add it. It has to sort of go through the vetting process, but that only usually takes a couple days. Anybody can do that. So if you have a program, you want to suggest it right on the site, every page at the bottom, you can go to suggest a program and you can add, volunteer transportation program that you're aware of or any other program.
Great. So I see we have quite a few hands up and we're going to try to make sure everybody gets a chance to share. So I see Chloe Gray. Did you want to go ahead?
Yeah, I had a question, or wondering if anybody has, with UberHealth, so we're not a healthcare based program. I'm with the foster grandparent senior companion volunteer program. So we have older adults that are volunteers and sometimes just need to be transported so that they can provide the volunteer service, which is not necessarily, providing transportation with others, but it's other types of volunteering. And so I don't know if UberHealth has certain qualifications for us to be able to use UberHealth. Do we have to be a healthcare provider? Looking at it this morning, I was seeing that there's also Uber Central, which is another thing, and then Uber for Business, where you can send rides to people. There's all these different Uber things, and it's really hard to figure out what's what. Right now we basically just use taxis for people, but some areas just don't even have taxis, and even in the Portland area, it's not a very reliable service that we use. So, we'd love to use Uber, but I feel like I'm just kind of really confused about all of the options.
I can connect with you and our partner at Uber offline.
That would be great.
They could, I'm sure, direct you into the correct lane of which Uber would be appropriate. It sounds like they definitely have a program that would be appropriate for you. So I'll connect with you offline.
Awesome. Thank you so much.
You're welcome.
And this is Zoe, and I would just add that I'm hearing a future topic of understanding how to use these Uber and Lyft programs for different needs. And I know Lyft also has Lyft Concierge. And one thing that is clearly, part of the issue when we talk about reliability is that they're market-based, so they don't function all that well in less densely populated areas because people don't want to drive there. They don't, they're not a great place to make money. So, but yeah, that would be a good topic for future. So Catherine, and then I see Aaron, and Luke put his hand down. So I don't know if he got his, but if we can get to you, Luke, we will. So Catherine, if you want to go ahead, and we'll try to be brief so we can fit in everybody.
Sure. Thanks, Zoe. I just want to share a resource with everyone. And it's called Rides in Sight. And it's a nonprofit transportation referral service. And it's the service that the Centers for Disease Control recommends people use. And it's www.ridesinsight.org. And it lists all the transportation services in the United States for older adults and people with mobility challenges. But it was specifically built for people with special needs. So you can search it by organizations that provide arm-through-arm and door-through-door service, which I think is what Alice was talking about. You can search it by that. You can search it by programs for veterans. You can search it by programs with wheelchair accessible vehicles. You can search it by programs that are free, and you can just search it, by everything. I think there are 41 different categories you can search by. And it is free. It also has an 800 toll-free number and has trained people to answer calls. And that is actually based in Portland, Maine, even though it's national. And it is the transportation service that the National Council on Aging uses for benefits checkup. We're in the process of rebuilding that website now. And organizations can get an API to it if they want. We can embed it in anybody's website. So there's a lot of national organizations now looking at it, because transportation is access to just about everything: food pantries and foster grandparents programs and healthcare and all of the social determinants of health. So we get that. Anyway, it's www.ridesinsight.org. And I'll put my contact information in the chat. So if anybody wants to ask any more questions about it, I'm happy to share. So all of the volunteer programs in the state of Maine are in that database, and it is searchable, and it is free, and it is available right now.
And I thought we put that on FindHelp, but now I'm not able to find it. At the very least, we can add that, as long as it's a direct service as opposed to just a directory. Like if people went on there, could they actually find a ride?
They can find, they can't book the ride from there, but they can find the ride from there.
Okay. Okay.
Okay. Yeah.
All right, Catherine, that's great. Catherine, I recognize your name from Massachusetts. I worked in this topic in Massachusetts.
Oh, really? Okay. How'd you get to Maine? Welcome.
But
Great. I'm going to go to Erin.
Hello. So I was late, so I didn't introduce myself on the chat, but I'm Erin, and I am the Senior Transportation Director at KVCAT. So I was going through the website. So this is really cool, and I didn't know it existed, so that's exciting. I was just searched in my area for transportation, and I'm a little concerned because Motive Care is showing up, and they don't operate in this area at all. This website very much implies that they do. So I would just
are you talking to me?
No, to the MaineHealth one.
Oh,
yeah, I would just go in there and say does not operate in, write a comment, does not operate in whatever your area is, and then send that message, and it'll change it.
It doesn't cover 3 regions, right? Like this implies that anyone in Maine can call them and get a trip, and that is absolutely not the case, like at all. Very much so, only certain people can call them to get a trip.
Yeah.
And those have to be pre-approved through MaineCare, right? It's a lot more complicated than just call us and we'll pick you up. And just, not to rain on everyone's parade, but for Uber, the Uber Lyft and all that stuff, I would like to recommend caution. If you guys are using state or federal money, Uber and Lyft are not typically staffed by people that have accessible vehicles. And if you're using state and federal money and you are offering that service to everyone but someone who has a disability or an accessibility issue, then you have an ADA violation. And the Department of Justice will come down on you very hard and very fast. So just a friendly heads up that it's a great service. Absolutely use it, but please be very careful to make sure that you're offering equitable services to all of the people you serve and not just the ambulatory and able-bodied ones, because it's really easy to go down that path. And then once the DOJ is involved, you're in trouble. So, and I say that coming from California, which is in a very, very, very litigious state. And so and that's, where Uber and Lyft started. So I sat back and watched a lot of ADA violation lawsuits go through, and it was ugly. So, but on a positive note, I'm just going to take a moment and let everyone know, for anyone who's in our general region. So we do the transportation for Kennebec and Somerset County. And for our public transit service, starting in January, on January 2nd, we're going to be transitioning to a demand response door-to-door escorted public transit service through the city of Augusta, the city of Waterville, and Skowhegan. And as we get, successful and bigger, the zones are scalable, right? So ideally we're starting small, but eventually we'll get bigger and bigger and get all the other cities involved. So, spread the word. And, if you find yourself in the area and in the zones, then, give us a call, and, we'll take you where you want to go, as long as it's within the zone. That's all I had to say.
Thank you, Erin. Well, I'm going to give a couple of really quick Moving Maine updates, and then we are going to wrap it up. Thank you so much to everybody today for being here. We are going to be looking at slightly beefing up our communications capacity, which I'm really excited about because I've been a one-woman show for a while. So we're probably going to be switching a little bit how we book these, how we RSVP and send reminders for these sessions. So apologies if you felt like you didn't know what was going on. You probably that was my fault. So looking forward to that. And we'll also be looking for input on upcoming sessions. So stay tuned for that. We also are going to be doing an open call for steering committee members. And so we'll share that. There are some sectors that we really want to make sure that we fill. We had a couple people move on. Keenan Weissstill from Disability Rights Maine has left Maine for a different job, so some big shoes to fill there, and also looking for people who can represent veterans issues and concerns and a few others. So really great to have so many people here, and I hope the transition into the fall goes well for everybody, and look forward to being in touch. So take care.
Thanks, Zoe.
Thanks, Zoe.